Olá, nós estamos mais uma vez na AUA 2024, no SBU-SP. Eu estou aqui com o Dr. David Johard, da Universidade de Wisconsin. Dr. Johard, thank you for your time. Yesterday you participated in an interesting crossfire debate, and I'd like to ask you, what is the current role of radical prostatectomy in the oligometastatic scenario?
Yes, thank you. Hola. So it's important when you manage these patients to have a multidisciplinary team involving radiation therapists, surgeons, medical oncologists, even pathologists. There are often situations we're faced with where patients present with more advanced cancers. And the question really is, does radical prostatectomy cure them? We don't know that answer definitively at this point. There are currently 2 large phase 3 trials that are going on. One of these is something called SWOG 1802, and the other is called SIMCAT. We'll have a more definitive answer regarding that once these trials are finished. However, there are situations that we face as urologists where we may consider radical prostatectomy in the face of oligometastatic disease. Certainly with PSMA PET scanning right now, we have a much better sense of where these cancers are. So I think it helps us in selecting the correct patients. The second thing is that if a patient has a significant amount of outlet obstruction, they're in retention, severe urinary symptoms, doing radiation is going to be a challenge. The third aspect about this is that there's some patients that simply just want surgery in this setting. And whether it in fact improves their lifespan or their cancer-specific survival is unclear. But what we do know is retrospective studies have suggested a benefit with regard to removing the prostate in the face of 2 or 3 metastases. The other aspect is that you're less likely to develop local control issues over the span of the lifetime of the patient. For example, these patients are living on order about 10% longer with the advent of some of the newer drugs that we have. So these things combined together, there may be a role in some selected patients, but certainly these clinical trials are important to support.
Thank you, Dr. Johard.